One Brave Idea project that started last AHA. I would like to give you a brief overview of where uh, we have gone since the idea came up. This is Dr. Fuster's slide, so switch to my slide. Um, as you know, AHA, Google, AstraZeneca selected Dr. McKay's project as a project choice, but there's been enormous amount of interest in this unique idea of going after the vulnerable patient and utilizing a machine learning, artificial intelligence, deep learning, all of these artificial neural network to attack the problem that really has been uh, in cardiology for a century, and that is near-term risk prediction. Whether we're able to identify those people who are going to have an event in the next few months, few weeks, few months, maximum a year. That's where we focused our project. We went on, as I said, submitted our project to the One Brave Idea. We specifically titled our project Machine Learning Heart Attack Alert System or Forecast System. And the goal is not just identification, but also opening path for developing new therapeutic targets. We are, as I was just telling Dr. Fuster, approaching multiple potential partners in funding source. This is a very unique project. In fact, there's no way to do this project prospectively. You would need somewhere around 20 to 50 million people, follow them for 5 years to come to the kind of sample size that we're collecting or aiming to collect. So we approached Google, Apple, Facebook, which was the most recent one. Actually, after Facebook, we made contact with IBM Watson. Some of you might know IBM Watson because it's an amazing era, opened an amazing era in computer world. You know, they were the first to bring computer and counting by machine 100 years ago or so. And then they were the first to bring the novel computer that we worked in the past 30 years or so. And now they're the first to bring cognitive computing, which is basically brain similar to what humans' brain does, learns and develop training for itself. So the focus for most of you have been with our movement of SHAPE for over 10 years, been identifying what precedes the event. For almost a decade, we focused on vulnerable plaque. We realized that we needed to move beyond vulnerable plaque to vulnerable patient, and the vulnerable patient has plaque, blood, and myocardium components. There's a video on SHAPE website for people who will access our presentation online, which is by far the largest part of the audience for this meeting. We have about an average 5,000 to 10,000 viewers for this meeting. So that's why we conduct our meeting online on webinar format and enable them to access these slides and videos. Post that concept of going to vulnerable patient, which received a lot of support. Of course, Dr. Fuster and Dr. Willerson at that time were the mentors that helped me develop this. Dr. Falk, and I also had help from Peter Libby to put this together. This was number one. Then we published number 2 quickly after that, from vulnerable plaque to vulnerable patient. And then took us several years because we didn't really have an easy way to go about identifying the vulnerable patient. And in the sort of land of blind, we found the one eye to be the king, and that became coronary calcium. Coronary calcium, through many meetings, this was the hallmark of meeting. You see Wolfgang going over there during fog. This was a closed door event where we had to throw shoes at each other to get through some of the basic agreements. And finally, we came up with the guidelines that named itself the SHAPE guidelines. Again, at that time, this is almost 10 years ago, 2006, and exactly 10 years ago, we didn't have the evidence that we do today, heavily supporting the value of subclinical atherosclerosis and coronary calcium. But that was our sort of general idea, and over years, we took a lot of bullets, particularly people who are in this picture. And here's one. That's Zahi, who's on the far left in this picture. Everybody took bullets for this stand. And I think we are in a place where we can say the body of evidence for coronary calcium and the approach that SHAPE took is now accepted. We don't have a formal concession from AHA-ACC that this is the way to go, but pretty much everybody realized the value of coronary calcium and what SHAPE put out. But as I said, when the one brave idea came up, we seized the opportunity to go after what SHAPE is about, and that is truly identifying the vulnerable patient. We know that coronary calcium brought a significant amount of predictive value, but it is far from our ideal test. So that project of machine learning vulnerable patient is going to complement what we need to see in this picture. This is the circle that we're going to. So coronary calcium covers this, and you will hear for a presentation of Dr. Kakadiaris that we will be even looking at vulnerable calcification as a possible pattern that we can recognize. And then we have a lot of homework to do with vulnerable blood, which is part of this project and proposal, and then vulnerable myocardium. So that is the machine learning project. The next announcement that I have, I was just getting permission from Dr. Pfister to break this to you. IBM Watson made history by beating world champion in Jeopardy. And that news really, for the first time, opened everybody's eyes to the value of cognitive computing and how that can revolutionize many fields, which is coming. The wave and the tsunami is coming. We haven't gotten there yet, but I believe the same approach that was taken with Jeopardy 5 years ago, 2011, can be taken in cardiology, and we want to be in medicine generally, but we want to be the first in medicine, cardiology, to do machine versus cardiologist. This idea came after my visit of ACC Fit Fellows in Training Jeopardy this year. Talk to the ACC, talk to the people there, and we're going to hopefully get IBM Watson to participate in this project. So imagine here is our best fellows who literally swallowed these textbooks and are answering all questions at the speed of light. And then here we hope that we will have our Dr. Watson. And so this is a project that is aiming at 2020 to be launched live at ACC. And I could not think of a better avatar than Dr. Rooster. If you haven't seen Dr. Rooster, I introduce you to the man who I call my mentor and has had a difficult time mentoring me because the distance and that I'm not quite listening. But I believe a Dr. Rooster versus cardiology isn't cooking and can be realized within, as I said, 20 by 2020. We had some discussions that it could be even earlier. Just knowing that Watson can read 800 million pages per minute. Now, we don't have 800 million pages in cardiology textbook, but reading the textbook, putting the context together, a lot of case and samples is the plan. So this was my uh, unannounced announcement. I just got the permission from Dr. Fuster to pursue this. This will be somewhat uh, out of uh, one of a patient topic, but it is well within the scope of bringing machine learning to patient care. With that, I'm going to go back to the topic of this meeting and summarize what we're going to hear tonight. We're going to hear discussions about this project, participant cohorts that are here, some of the representatives and some who are not here and will participate later. Uh, I had a very good discussion with Dr. Levy from Framingham Heart Study. He had to leave, but we spent about an hour discussing some of the details. And then we'll hear from other people who are going to participate in this study. As I was just telling Dr. Fuster about our approach to Google, Apple, Facebook, and Watson, IBM, he brought to my attention that he had also discussions with them. So Dr. Fuster has some slides to share with you. Then after that, I'd like to pass the podium to our moderator, Dr. Marin and Dr. Narula, for a brief introduction from their point of view, how they see machine learning. I know Dr. Marin gave a talk yesterday about machine learning and baseline study, and Dr. Narula has been following this for a long time from the site. So without further ado, please, Dr. Narula, take it away. Then Dr. Marin, a few minutes, and then Dr. Fuster's slides coming up.
Marin first.
Any comments? Any? Yes.
Have you already gone around the room with?
That's what you were going.
Oh, that's what I'm going to do. Okay. Well, I'll start it. I'm David Marin. Yes, Barry is my cousin. If you were wondering, he's the famous Marin. I'm a preventive cardiologist at Stanford, and I'm a total novice when it comes to machine learning. I'm just at the right place at the right time to be involved in this great idea. Stanford will be the coordinating center for organizing the collection and analysis of biospecimens, and that's my primary role for participating in this study. Mort, I don't know if why don't we go around the room?
Yes.
What do you think? Yanis Gagapiaris, University of Houston.
I'm Blakely with medicine and Kudenshi out of Japan.
I'm Director of Preventive Cardiology, UT Southwestern, and I focus on Dallas.
very much from Valencia. I'm Kenneth Katani, I'm from Valencia. This road is really good Valencia University. Johnny Payat from Lausanne, New York.
Valentin Fuster from New York. David Miller from Mountain View.
James Rudd from Cambridge, UK.
Wolfgang König from the German Central Union. Martin Mortensen from Aarhus University, Denmark.
Erling Feld from Aarhus University in England.
Arvid Koning, Professor of Public Health at the Working Institute in the Netherlands.
Undergraduate Director of Cardiology, Methodist Hospitals in Maryville, Virginia.
Wonderful. More Naghavi here, and sorry.
Mike Bond, Director of Clinical Research, Johns Hopkins, Security Center for Prevention Purposes.
Thank you.
I'm Ahmed Gul, Rising Shape Society intern, working with Dr.
Yes.
Naghavi on his project. It's lovely to have you all here. Fascinated. You guys are all my role models, and hopefully I'm pursuing medicine in the future cardiologist, hopefully. So thank you all for being here.
Thank you. Let's give a round of applause for Ahmed's support. So, Dr. Fuster's slide is off. The meeting will be after Dr. Fuster's presentation. We'll be in a dynamic mode. We have a very featured presentation by our machine learning guru, Dr. Kakadiaris, and then we'll go into very much of a back and forth.